WHO has declared COVID-19 a pandemic, but what does that mean for both the general public as well as the health industry?
To help us take a deep dive into this issue, joining us live in the studio is the anchor of Clinica Flavier on 1PH, Dr. Jondi Flavier. Good afternoon, Doc. Thank you for joining us.
Good afternoon, Sean. Charles, thank you for the invitation.
Doc, during these times, it's very comforting to have a doctor on the show because there's so much news that's floating around, and I'm sure everyone's been bugging you, even friends messaging you. So exactly when should we panic? Should we panic at all? I mean, what do we do? This is like now a mental thing, you know?
Exactly.
Physically, like we can only do so much, but mentally we can do a lot, right?
And it's also the same for physicians and doctors like me. There's no cure for COVID-19 and there's no immunization program for it yet. So that's the frightening part. But that's also my way of saying that there's a lot that we can do. And panic, or what I call convulsive activity, is not what we should do. It's calm, careful, and correct action that we need.
All right, so let's distinguish those things that are within our control and those that are not. From what we know, there are certain individuals who are at a higher risk of contracting the coronavirus and maybe developing symptoms. Could you tell us more about this and exactly how do we guard against this?
The advantage for the Philippines is we can see what's happening around the world. What happened in Wuhan, what happened in China, and elsewhere in the globe. And that is precisely our point. Among all these 60,000 or 75,000 people who got sick in China, the bulk of those were older persons. But let me qualify, older persons who have pre-existing or underlying problems. So first point, make sure that our older people who tend to be immunocompromised or less resistant have enough food, water, and are healthy. Number two, if they have an underlying problem, they should continue with their medication. So this will not be an important problem. And then the third, and most important, the way it's spread. It's now a pandemic. It was just an outbreak in Wuhan. I like the map you're showing, but if you put it further back, it was just a small blip in Wuhan in December. Just 3 months after, it became an epidemic in the whole country of China, and now it's spread across the world. But what can we do? The panic part is the pandemic sound. Pandemic just means it's spread throughout the world, but when you translate this to how severe the infection is, then we can soften our action. Number one, among all those that get sick, among 5 who get sick, only 1 is subject to the more severe problems. The 4 others, or 80%, get well and just have mild symptoms.
So is it true that for the 4 of those people out of 5 that it just feels like a really bad flu? Or sometimes like a medium flu or a mild flu for some?
More of a colds and cough, which is what it's related to. The common cold that we see in temperate countries during December. So what can be done in this case is, number one, for those who are worried, the sign that they should look for is difficulty breathing. So that's a sign that it's not just ordinary cough, it's not just ordinary fever, but now you're having problems in the lungs, and that's the difficulty breathing. Number 2 that we have to look at is, unfortunately, because it's so mild, as you said, you tend to disregard that.
It's easily confusable with something
just a cold, which you would never go to the hospital for.
And you're not going to the hospital, you're going all around, and sometimes you're insensitive and you cough.
Hindi kaya yan, I don't have it. But then, exactly where do we draw the line, Doc? When should, like, let's say going back to your example, 1 out of 5 people will get terribly sick. For that one person, can we recommend, like, vitamin C overdose, or should we just be quarantining all of our senior citizens offhand? What's the suggested approach?
The thing that we've seen is basically these 1 who are susceptible should be healthy, eat well, drink proper fluids, and get hydrated. Now, where is the action? For these guys, it's the hospital, because the difficulty breathing requires ventilatory or respiratory support. But the action is on these 4 other guys. So that's where we'd like to remind the audience about what we can do. And the most we can do is right now avoid areas where there's a lot of crowding and transfer of infection is possible. Number two, before I go to number two, that's what was done in China in a very draconian way.
Yes.
They really
So
closed up
intense.
all the.
Yeah.
But if you see in your map, it was growing very fast, then it plateaued
Flat siya,
because
yes.
of draconian measures. I'm not sure we can do that here, but the other good part of your map was South Korea and Taiwan, where there was an initial upsurge, but because of things that they did there was a more controlled picture that we're seeing. And what were these things? Number one, the schools, the Chinese holiday was suspended,
They
and the travel.
canceled Chinese New Year, I remember.
That's a very
yeah.
strong poster.
Big deal.
Yeah. And number two, they did not go as far as lockdowns, but they were very conscious about making the supply of hand sanitizers. And my co-anchor in Jondi Flavier was there in South Korea. She noted that every so often there would be public service announcements. Don't forget to wash your hands. Please practice coughing properly. So those things are what most people should be doing. Staying healthy, being polite, and making sure you don't spread the virus, avoiding crowds and the like. Those are important things that we must be doing.
Right.
But
Right
if
now-
you go to the
yeah,
point
yeah.
that you have difficulty breathing, that's the problem that has to be addressed soonest.
Right now, okay, like officials are thinking, a lot of news going around, whether or not it's true, thinking about locking down Metro Manila. And
Okay.
there is reason to kind of worry about that because we've seen countries do that. Italy
Yes.
has done it. Medically speaking, is this a good idea?
Okay.
I mean, like it would be easier if you're just a doctor and there's no other consideration to just lock it down,
Yep.
sort of in a draconian way,
Yeah.
Okay.
if you can.
When you say medical, there must be evidence.
Okay.
And unfortunately, the evidence goes both ways. In China, we seem to see some good effect. But in South Korea and Taiwan, and I think even in Vietnam, it didn't go to that extreme case. But the picture is still improving. So that's my long way of saying that lockdown or not locking down is still
It's debatable.
it's still debatable.
Okay, okay.
And number two, when you say lockdown in the Philippines, I'm looking at Taal, I'm looking at I'm
It's
not
the
sure
enforcement
if
issue.
we're supposed to have locked down schools, but kids are out in the street playing and the like. So I'm not sure that that will work.
Right.
So I tend to lean towards preventing the spread by keeping clean,
Hygiene.
hygienic measures, and the like.
But then how do we assuage dust? Like, for example, people who go to the office every day.
Okay,
I
yes.
have some individuals in mind who have been ordered to work from home, etc. Would you recommend that offices, like companies in general, undertake these types of measures, work from home, or maybe asking only essential personnel to show up
Okay.
to work? What's this measure compared to, let's say, a total lockdown? Which
Okay.
one makes more sense?
May I broaden the picture? We're
Sure.
only looking at coronavirus. But in the Philippines, the bigger problem is tuberculosis. The bigger problem is a lot of infectious diseases before you get to corona. My way of pointing out that corona kills 1 in 100. Tuberculosis has been killing a lot of people in the Philippines for the longest time. So what we really have to do is preventive measures. For TB, the good part is there's a vaccine, there's medication. But the action that we take, should it be extreme? When you're given an array of potential actions, I would defer on the less draconian day-to-day health measures rather than locking up in your house or room and
But Doc, that
playing video
requires a
games.
lot of participation from the general public, which
Everybody.
is a little bit more difficult to
Yes,
achieve. So you're actually suggesting a more democratic way of doing this, which means every single member of society has to participate in it.
Yep.
And in fairness to Filipinos recently, I have not gotten, I went on a plane last month and I swear nobody coughed, sniffled, or cleared their throat the entire time.
Yeah.
People now are wearing masks. They're practicing proper hygiene,
Yep.
where a lot more, which should be normal, right? That's
That's
what
correct.
you're saying. So is this a good start for us? There's like a wake-up call for us to practice proper hygiene and really value the importance of personal hygiene. And
Definitely,
you're concerned
yeah.
for your So basically, at the end of the day, that's really the best way to prevent the spread of this.
Yes, and avoiding the others. For example, the masks tend to be the fad.
Exactly, I was gonna
But
ask.
if you're using masks and using it all the time, you just collect the infection or whatever, and then you don't throw it, that's going to be more harmful. It's still better to continue hand washing
Right.
and
So,
the like.
what are the simplest things that anyone can do? Like for me, example, I take 100 mg vitamin C
Okay.
first thing in the morning and sometimes before going to bed. Is that
Yes.
advisable? And what other things, apart from the obvious proper hand washing, etc.? What are other hacks that we can do just to keep people calm?
Not hacks, but you're too light. You need a lot of vitamin D.
D, I see.
From the sun.
Vitamin D is a very, very healthy vitamin and supplement that you don't have to get orally, but going out in the sun will be good for you. So those are all essential vitamins that day-to-day ordinary Filipinos can take advantage
So
of.
how much time do you recommend we stay out in the sun
Yeah.
per day? I'm
Short
really
of
interested
getting
in this.
sunburned, the healthy time is before 10 o'clock, before 9 o'clock, and after 4 o'clock.
How long
The
do you have to
sunlight,
be exposed? Like 10 minutes?
10 to 15 minutes should do the trick for vitamin D. So that would be just enough for you.
All right, so
Yeah, we know now where to draw the line, when to have ourselves tested, once you have the difficulty breathing. But
That's
for
right.
everybody, stay calm. Huh?
Can I give good news?
Go ahead,
yes, of
please.
course.
But
We could use some of that.
because of this coronavirus, because of the change in behavior and our focus on what to do about coronavirus, I'm guessing and I'm suggesting that all our other problems that are spread by coughing and are also affected.
As parang
So
the
as
opposite
you're-
of collateral damage.
That's right. So it's a good effect that the coronavirus consciousness and action is causing on Filipinos.
All right, great. I suppose this is the wake-up call that we've all been waiting for. Thanks again for your time. That was Dr. Jondi Flavier, anchor of Clinica Flavier on 1PH.